All right, well, I think we will go ahead and get started here. And let me grab the agenda. And I'm going to, as I go through this morning's roster, we have a few changes on the roster, so I want to note those as I go through and call roll. So starting down the list, Kate Allen, I know Kate said that she wouldn't be able to make it. Amy Baker, are you here? Okay, Teresa Barnes. Hi, Teresa. Jonah, I think I did see you. Yep. Mike Davis, I see you. Alan Evans. Okay. Sean Fitzpatrick. Kenny Hansen. Sarah Lou. Jennifer Holland, and I think she said she couldn't make it. She had a conflict. Jared, I did see you. Former Mayor Lemire, I do see you. Melissa Linder. Viviana, I did see you. Lisa McLean. I don't think Lisa's going to be here. Ozark or Oz, are you here? Jan Peacher? Cindy, I saw you. David Reed, I saw you. Councillor Rocca, I saw you.
Right here in the skunk cabbage.
Okay, cool. I'm here. Brooke, I see you. Monica is, I know she told me she's on the road, but she's going to be hopefully signing in just a little bit late.
I'm
Terry?
here, Chief.
Oh, okay, great. Thank you. And Terry, I see you're online. And Raven, I think Raven was going to try to sign on, but she might have a conflict. So looks like everybody is here. So as far as changes are some of our newest additions, and just as a reminder, the mayor is the one that sets and approves the roster, and the following names have been approved. Teresa Barnes from the Warming Center. Welcome, Teresa. Mike Davis, I think you were actually a newest member at our last meeting, so I think you're still good, of course. Let's see. And then Oz from Filling Empty Bellies is one of our newer members. Raven, I don't think she's here, but she does have a name change to Raven Walsh. She got married a couple weeks ago, so congratulations, Raven. Tom Liner, now former member, they're moving up to Washington, to Port Townsend area for a job opportunity for his wife. So Tom, we appreciate your service. I know he's going to be hanging around Astoria still here and there, so hopefully we will still see him, and he wanted to stay on the guest list because he's already signed up for some involvement in homelessness issues in that community, so good for Tom. Did I miss anybody that's new member? We've had quite a few changes, so Oz, I see you just signed in, so welcome. I'll mark you down on the roster here. Thank you. Okay, Mayor, if you have any opening comments, fine, and then I'll jump to logistics after that.
Okay, well, welcome everybody. And just real quickly, since our last meeting, the City Council established its goals for the next 2-year period, and I wanted to just review the goal regarding homelessness. And it is to support the work and recommendations of the Homelessness Solutions Task Force, as well as other community efforts to address homelessness and specifically explore partnerships for Housing First programs and a countywide drop-in center. And so those are the goals. And then the other thing I want to note is that we'll cover it later, but Chief Spalding took the initiative to send a survey out, and we realized that even though we always say we are open to new ideas, and this group is to serve the needs of the group members, we never actually did a formal survey. So it was a great idea by Chief Spalding to do a formal survey, If you haven't filled it out yet, please take just 2 minutes after the meeting and fill out the short survey so that we can be sure that the group continues to serve the needs of the members. Thank you.
Thank you, Mayor. Appreciate that. And I don't know if anyone can hear that beeping going off in the background. It could be a fire alarm here at the police department. So fortunately, the fire department's next door, so I feel pretty safe. But there's a possibility I may have to evacuate. So we might have to put the meeting on pause, but I'll let you know as soon as someone comes and drags me out of my office here. So I'm not really sitting in front of the bridge. So anyway, with that being said, just a few logistical things. Again, just as a reminder, please keep your phones muted and until you would like to speak. This is a member-based group. However, we do value the opinions and thoughts from our guests. Many of our great ideas have come from our guests. Throughout the meeting, though, if there's any items that are voted on, it's voted on by a member of the group, and the discussion generally surrounds the members. But oftentimes we have time to be able to open up to the guests. So I don't want anyone to feel excluded, but also are trying to follow the appropriate protocols as well. Let's see. So Megan McCall from CCA is taking notes for us. So thank you, Megan. I appreciate you doing that. And so unlike me, try not to talk too fast so she can capture everything. So with that being said, we will ask for an approval of the minutes from the last meeting.
Approve the minutes.
Second, David Reed.
Councilor Rocca and David, second. Any discussion? Okay, all in favor, say aye, or actually wave your hand. Okay, any opposed? Okay, motion carries. Thank you. So on the vaccination front, as some of you may have read the article in the paper a couple days on the homelessness vaccinations, I believe Julie Hesse is here and to talk a little bit about that on behalf of public health. I do see you, Julia. Sorry, I said Julie. And can you pronounce your last name? I just want to make sure I'm getting it right.
Yeah, it's Hess with a silent E.
Okay.
Or Hesse if you're in Germany.
Okay, thank you. You're on.
Okay, I think Susan Prettyman or Viviana can talk more about the health and wellness fair that they put on, and that grew from a conversation we had about how can we do outreach to the homeless population for vaccination. So I'll let them talk about that because what I saw, it was really a big success. It was great. Public health was there. Lisa McLean was there. She gave 20 vaccines and she was really, really happy with that number. She didn't expect to do that many. And they also handed out naloxone. Is that what it is? They handed out several of those with the training that goes along with it. So they were really happy. They didn't get rid of enough condoms. They wanted to give away more condoms, but and so for future vaccines, Lisa wasn't able to be here today, so she asked me to let you know that she is going to she's planning on attending the warming shelter shower days. I guess they have those on special days, so she can be available to vaccinate people that want the vaccine. And they're also talking about setting up pop-up clinics, possibly with lunches. Or other places that might be identified, and we are open to suggestions. And she said, if anybody needs a vaccination, tell them to stop by the health department. But what I'm hearing is that doesn't work because usually the nurses are out in the field. But you can call Lisa, and I can drop her number in the chat. If somebody needs a vaccination, a homeless person needs a vaccination. Otherwise, we're running people through our mass vaccination clinics. That's by appointment only, and I can give you more information on that if you need it, but that's a separate topic from vaccinations for the homeless. Any questions?
Julia, Julia, just one question. I think I understood that the vaccine was the one-shot dose for the almost.
Yeah, the Johnson & Johnson, they're setting aside the doses of those for the hard to reach populations, such as people that are homebound or homeless or other odd cases, because there is a limited supply.
Okay, makes sense.
Thank you.
Yeah. All right, thank you, Julia. Appreciate that.
Thank you so much.
Mike from Helping Hands. Mike, I'm guessing maybe you have some connection issue there. You look a little frozen in time.
And we do have, can you hear me?
Now I can, yep.
Okay, apologies. Our Astoria location, the men's long-term reentry program is running at full capacity right now, but we do have availability in our emergency shelter beds. And women, we're at about 75% COVID capacity with emergency shelter beds as well. They did ask if anyone has any connections to some art supplies and some basic garden tools, that would be really helpful. And they wanted me to share with you one of our success stories. One of our participants that's been in our women's shelter for about a year now has regained custody of our 2 children and is actually graduating and moving on to independent housing. And we're very excited and very proud of her for that. So just wanted to call that out. Our Seaside location, which is our long-term women's shelter, we're about 75% of COVID capacity right now. So we could take a few more people in that location as well if people are working down in the Seaside location. We are working at expanding like as fast as we possibly can. We do know that Portland State University recently released a study that they anticipate about 89,000 people could face eviction when the moratoriums expire, which is going to be about a $3.3 billion impact on the Oregon economy. And so our Lincoln City project is moving along very well. We hope to open that here in the fall. And we're looking to begin construction again on the second phase in our Portland location. When those are both done, we expect we'll be doubling our capacity that we're able to serve. That is all I have. Any questions? Thank you.
Thank you, Mike. I appreciate the update. That's good news on the capacity expansion. Good news. All righty. Viviana, you are up, and we appreciate your work on the homeless liaison position. And I don't think many of the people in the group here are aware of the second position, so I'll let you talk everything homeless liaison related.
Great. Good morning, everybody. So we did hire 2 homeless liaisons. Both started on April 1st, April Fool's Day, and one only lasted a week. She felt it was not a good fit for her. So we still have Cheryl Paul as a homeless liaison here in Clatsop County. We are in the process of interviewing more candidates this week and next week. So hopefully we have the second position filled pretty soon. And Cheryl Paul has been going to Seaside pretty much every day, connecting people who have been in campers to different housing options. And so that's what I have from the homeless liaison piece. If you know of anybody who is interested in the position, please let me know. For some reason or another, we have not received as many applications as we were hoping for. And I think CCA is not the only one who is having issues with people applying for jobs. We are seeing all of that all over. But if you do know somebody who is very good with essentially customer service, and I'm sorry, I got distracted by somebody. But anyway, please let me know. The pay rate is from 17 to 21, 22, depends on experience, and full benefits and 40 hours a week. That's what I have about the homeless liaison. Do you want me to talk a little bit about the health and wellness that we had?
Yeah, Viviana, that'd be great. But also if you would maybe talk just a little bit more about some of the role of this person, what they're actually doing right now. You know, I know we talked about what we envisioned they would do before the program started, but you know, what are some of the day-to-day duties?
So
I'm not sure.
I can give you some you know, some example of what Cheryl has been doing. Cheryl was contacted. Cheryl Paul, the homeless liaison. She was contacted by city councils of Seaside because they were, you know, there were a lot of campers parked on 12th Street in Seaside. And then she, with another case manager from CCA, had been going and trying to find solutions for the people who were been camping. And we were able to house one individual who had chronically illness and also store the camper. So Cheryl has been working with this, with the not only with the homeless people, but also with landlords and other housing options to be able to move the people from 12th Street, from camping on 12th Street. She has been connecting with a lot of people from Seaside because her knowledge about houseless people is mostly in Astoria, but she's getting to know the population in Seaside as well, and then move on to Warrenton. She is not going by herself because of, for many different reasons. She is pairing with a case manager from Plaza Community Action until we hire a second homeless liaison. And her hours are, you know, 40 hours a week, and she's going and coming to Seaside and all of that. So making sure that people are knowing that she is available. And then we are hoping for Cheryl to start doing a tour for all the different agencies and connecting with all the different agencies once we hire the second person. Yeah. Do you have any questions? Essentially, we want the homeless liaison to be connected to all the agencies, be connected with the police departments from different cities and city councils, and trying to, you know, come up with the housing options for our houseless populations, the ones that are ready for, because a lot of them are not ready for housing. So, but we are giving those the option.
Viviana,
We do.
Are you promoting this by providing a phone number, or how do people access the services? And is there any kind of a screening process?
Yeah, so then we wanted to have the entire month of April for the homeless liaisons to learn what CCA does and then connect it to the agencies here in Astoria. But because of the second homeless liaison resigning from the position, that threw us off the curve here. And then, but we are hoping to have I'm going to get a cell phone for Cheryl today. And then we are going to send that cell phone out to all the community partners so they can have a way to contact Cheryl directly without calling the CCA office. So as soon as I have that in place, you will all have that number. And as of right now, Cheryl will be working only Monday through Friday. Once we hire a second homeless liaison, that might change. I don't want to send Cheryl by herself to see anybody. I need her to be partnered with another person from either CCA or the second homeless liaison. And at this time, I'm not able to pay overtime over the weekends, but that's why we are doing it Monday through Friday right now. And then the homeless liaison, we did have a homeless liaison council member meeting. We did have it a couple of weeks ago. It's a group of people who represent different agencies to be able to oversee the position of homeless liaison. And then we met about 2 weeks ago in just to give a report of what the homeless liaison have been doing and come up with ideas and metrics and goals within the next year to make sure that it is a position that is going to bring positiveness to our county.
Okay, is there any questions for Viviana before she talks a little bit about the wellness piece? So please raise your hand or do a shout out.
And then if you have questions later on, you're more than welcome to email me at any time.
Okay, Viviana, why don't you go ahead with the other piece, the wellness?
Yeah, I just want to ask if everybody had their coffee today. Am I the only one with full of energy here? Yeah, thank you. So CCA was contacted by the health department about a month and a half ago of coming up with an idea of how to vaccinate the houseless, the unsheltered population in Clatsop County. And then I contacted OHA for fundings to see if we'll be able to provide a health and wellness activity in such a short time, because that means it's going to require a lot of money because we are not counting on volunteers and we're not counting on donations or sponsorship. So OHA gracefully gave us some fundings to be able to do, and also the CCO, Columbia Pacific CCO, to help us put together a health and wellness event for our houseless and sheltered population here in Clatsop County. We did intensive outreach process, and then we were able to bring from outside of Clatsop County a mobile shower. We were able to provide to-go lunches for everybody who came to the event. We had vaccinations available. We had clothing, and also we had a lot of giveaways. So everybody received a backpack with items such as a cell phone charger, water, sleeping bag, and so on. And then we had about a little bit over 60 people coming through the door, and the health department brought in with them 20 vaccines, COVID-19 vaccines, and they used all of them. What else? And Susan, she took the lead on the event. I just took the lead on the funding. And Susan and I put it all together, but Susan might have some more things to add to it.
I would just add a thank you to the agencies that were willing to participate and be there. I think it's really, really amazing when our community comes together. We had a table set up for CBH. The VA was there. Like you said, we had a free meal. We had the shower station. We had hairstylists come in and do free haircuts. Head Start was there. There was some information from the harbor there. And it was a really great event to have more than 60 people show up. And I can tell you that we opened the doors at 10 and we had a line outside 30 minutes before that. And so I think that just speaks to what our agencies can do when we work together in a very short time frame.
And then I am willing to do another health and wellness activity in Seaside. So if the health department wants to put this, help us with the vaccinations, and then we'll be able to do it again. Just because we did it in Astoria, we know how we can do it in such a short time. So towards the middle of the summer or even before summer. Mm-hmm. So hopefully we'll have one more event in Seaside. And Julia says yes. And then we just have to pick a date, and a location will be easy in Seaside. We have a very good relationship with the convention center. And then we'll just need a few weeks to put it together. Mm-hmm. I think it's important for us to offer the same services in Seaside and same as Warrenton, because Clatsop Community Action covers the entire county. And also transportation was offered to the health and wellness by the transportation here, SETD. Thank you.
Thank you, Viviana. Any other questions for Viviana or Susan?
I have a question. This is Julia again. Did you have people come up from South County? Did they use the transportation?
You did, yes.
We did.
All right. Thank you.
But if we have one in Seaside, then we can open that to people coming from Cannon Beach and farther than Seaside.
Yeah.
And outside the outskirts of Seaside. So I think we should do it, Julia. What do you think?
I think so too. I'll tell Lisa she's going to.
Okay.
Okay. Thank you.
Thank you.
Thanks again, Viviana. Appreciate it. Monica, are you still online there? Monica?
Can you hear me now?
Yep, we can hear you now.
Can you hear me now? Okay.
Yep, you are
Sorry,
up for an update.
Okay, I apologize if you lose me. My Verizon connection hasn't been great lately. So I just wanted to provide an update in regards to the county and the work that is being done through the strategic planning process. The board recently adopted the strategic plan goals, which I believe I mentioned in the last meeting. And in those goals, it's to establish a navigation center. And so we are currently going through our budget process, and we do have funds allocated to try and get this up and running in the 21-22 calendar year. And so I'm excited to hear that the Astoria City Council also has this in their goals as well, because it's really going to be a partnership among all of our community partners here in the county. And so one of the things that we're going to be looking at is who all of those community partners are going to be. I know that there's been a lot of conversation about duplication of services and how the Beacon House is currently a drop-in center. And I think it's important to recognize that there are certain limitations that the Beacon House has, and for good reasons. They are trying to help a population that has been referred there because of certain mental health conditions. And so they want to make sure that when they are welcoming their guests there, that they are taking care of the environment that they're in. And the Navigation Center is going to be open and used most likely by those individuals as well, but it's going to be open to everybody. And so it's hopefully going to be able to have a place where people can come to not only take a shower or wash some clothes, similar to what is also available at the warming shelter, but this will hopefully be year round. Also be able to get meals, be able to have appointments for mental health as well as public health visits, be able to possibly, in some instances, see other types of specialty services such as
Monica, I think I know we're starting to lose you there. Maybe you're going through a bad cell. Okay, you're back.
Okay, sorry. So we're just trying to reach out to different community partners at this point to see if their level of interest in participation in the Navigation Center is there. So that way we can identify who the groups are going to be that are set up here. And then still trying to identify where this location would best be. Because to Viviana's point, this is a county effort that we are making. And so we want to make sure that we are in a viable location to address the entire county population. Because of
Monica, I think you're cutting out a little bit again.
I apologize that I had to travel today during this meeting. But if I can send you, I can write up a a report for you, Chief, and then if you want to email it out to the membership.
Yeah, I'd be happy to do that. And just for my clarification, is there a difference between a navigation center and a drop-in center?
I would say that it's essentially the same sort of thing. The term has been used both ways, and that's something else that we can further define as we work through this with community partners. A lot of people are saying navigation center because we're just trying to help them navigate different types of services that they would be needing, and it would be on a drop-in basis. So you aren't necessarily needing to have an appointment to come in there.
Okay, gotcha. And then just for clarification, Oz shared with us that the Beacon Clubhouse is not a drop-in center. So Oz, would you mind maybe for everybody's benefit, just telling us a little bit about, what the Beacon Clubhouse does?
The Beacon Clubhouse is a member-only organization for people with mental illness. We are referral-based. People cannot just drop in. You have to be a member to be here. And we have we have guidelines that we have to follow in order for people to come into our doors. So we are definitely not a drop-in center. We've had a lot of organizations directing people to us and thinking that we were a drop-in center. And please, we are not. We can't be a drop-in center. We'll get in trouble if we have people dropping in here. The closest thing, I represent Filling Empty Bellies, and I'm also the staff generalist at Beacon Clubhouse. So Filling Empty Bellies is welcome to, or are willing to do and help people with drop-in center style stuff, but we can't do that at the Beacon Clubhouse. Sorry if I didn't explain what we do here, though. So members come in and they can engage in our units. So we have a culinary unit, we have an art unit, wellness unit, and then we have a resource computer center. So it's basically an engagement. We want people to come in and engage, and they're welcome to help us to figure out what it is exactly that they want to do. Like one of our members is really into tie-dye, so we do tie-dye once every couple of weeks or so. We do collages. We do gardening, we do walks, we do yoga. It's just kind of wide open, but the whole thing is to get them engaged and running the clubhouse themselves.
You guys work closely with CBH, or how is that partnership?
We work very closely with CBH. That's where most of our referrals are from. CBH and their open door there. And we help people. We do help people get housed, and we do resource. We do help people find resources, but they have to be a member first before that we can actually help them with that stuff. So yeah, we work very closely with CBH.
Great. All right. Thank you, Oz. Appreciate it. Monica, any other final thoughts?
I would just like to share in regards to some of the work that the homeless liaison is doing. The county is excited to work with CCA on this. And one of the things that we are hoping to gather more data on is we all know that we have a housing issue throughout the county, and trying to establish what type of housing needs are most immediate. Like Viviana mentioned, in some instances, some of the people who are currently unhoused aren't ready to move into certain types of housing situations. And so trying to identify, just beyond the fact that we need more housing, what type of housing that is, whether that's transitional, whether that's permanent supportive, whether it's emergency shelters. And then also just trying to see what sorts of programs there might be. We are a tourist destination where a lot of people come to camp. And so even to come here, if you are living out of an RV, is not very affordable. And so trying to figure out what sort of options there might be for those who have shelter, just don't have a place to park that shelter that is appropriate. And so those are things that we're hoping to work on with CCA and the homeless liaison position as we move into the 21-22 fiscal year and try to further address our housing issue.
All right, great. Thank you, Monica. Any questions for Monica?
May I add something else though?
Of course.
When Cheryl and our case managers helped this individual from Seaside, we did not house them from one RV to another RV. We housed them to permanent housing because she was ready for it. But if she would not have been ready, our options were extremely limited, very limited. Mm-hmm. So yeah. Thank you.
Makes sense. Okay, any other questions? Okay, we're going to move towards our guest, Ron Maxted, doing an update on the Opportunity Village. And then, Ron, let me know when you want me to put up a copy of the minutes.
Okay, thank you very much. Thank you, Mayor Bruce Jones and Chief Spalding. I just want to give a little update of the one-year history of Astoria Opportunity Village project. We are a subcommittee of this host group forming last year, establishing our name, Astoria Opportunity Village, and a vision statement. And a short section of the vision statement is Astoria Operational Village is a collaboration between housed and unhoused to provide stable and safe places for unhoused to live as they transition to a more sustainable living situation in partnership with local county municipalities. So as Astoria Opportunity Village providing cost-effective and humanitarian approaches to this transition. Temporary housing only. This year, 2021, we have formed a guidance committee to this larger group of Astoria Opportunity Village. Following the guidance of our mayor, Bruce Jones, who suggested that we incorporate the local social service agencies and county organizations. So we have formed this guiding committee, and we have some key players in this that are currently taking care of the welfare of our unhoused in Clatsop County. Viviana Matthews, which we all know, Terry Steenbergen from the Harbor, Amy Baker from Clatsop Behavioral Healthcare, Monica Steele from the county, and Lauren Wilson, who was at the county but is recently retired but is on our guiding committee. And also a very experienced health social worker, Bill Black. Bill brings a wealth of experience and knowledge from many years of working with the unhoused. This, in combination with our mentor group, which is Opportunity Village in Eugene, which has been mentoring our progress through SquareOneVillages.org. Dan Bryant has given us tips on accomplishing what they have successfully done in their county in Eugene. We had our first guidance committee, and Chief, if you would, thank you. And this is our first meeting, and we've identified some things that we are asking the host group to. We're looking for suggestions and help and any guidance that you might bring forth. And that we've decided that we're not going to form a nonprofit until we get more established, more people wanting to participate. And we are looking to become a fiscal partner with another nonprofit. So a fiscal partnership would mean that we'd be able to use their nonprofit status for fundraising and go forward in that way. So I would like to know, we're not sure if there's a state agency that might be willing to step in and help us in that. But so we're looking for suggestions from the host group on that. I have talked to Danielle Hall, the acting interim president of the Warming Center, and we've been talking about the possibility of maybe going further with some discussion on that. Until we establish this important link for our organization, we are in a holding pattern. Once that is established, we are looking forward to putting together a transitional house model. And we would be looking to put it on a trailer so we can move it to different locations, for instance, like maybe the Safeway parking lot or something, and having an open house on Saturdays and saying, this is what a transitional house looks like. And also that will increase our base, garner support for the project, for actually a village. And so in that regard, we are looking for suggestions from the host committee about the possibility of a trailer. We need a trailer to pull this model around. And of course, we haven't figured out whether just to buy a one transitional home that is available or to actually involve the community into building one. And this particular step, that building of a transitional home, can be an opportunity to enlist people that would be interested. I already have a list of people that want to participate in that sort of a project, and that might help us go forward. And let me see, I think that is it. You can see our minutes, and if you have any suggestions going forward, you could give me a contact by text, works best. My number is 503-338-9153. Thank you.
All right. Thank you, Ron. Anybody have any questions for Ron? Okay, seeing none, please feel free to reach out to Ron if you do have any questions, and if you want to get a copy of the minutes, I'm sure he'd be happy to send those to you from his meeting. And Ron, I appreciate the work you're doing on that. Thank you. So let's see, homeless activity. So I'll just briefly talk a little bit about where we're at numbers wise. The good news is that the numbers are down and fairly substantially. Not really sure why, but I'm not complaining. Just as far as numbers go, as a reminder, in the year 2020, we had 786 homeless related calls for service. This year, we've had 169 to date as of this morning, homeless calls, and 14 aggressive related homeless calls for a total of 183. And if you divide that by 126 days is where we're at today, we're averaging about 1.4, 1.5 per day compared to last year, which was 2 and 2.2. So it is down quite a bit. So good news on the homeless call front. Any questions on that? Okay.
I do, Chief Spalding.
You're welcome. Yes, Viviana.
Do you think the numbers are low because people are staying in their homes because of pandemic and people are not seeing misbehaving actions and people are not reporting because they're not on the street?
Yeah, I don't know. Honestly, I'd be guessing. I will say there is one fairly significant factor is 2 individuals who were responsible for a significant amount of our calls have not been in our community. And so I know that was a significant one. One of those individuals had over 300 calls for service over a few years, but nonetheless substantial. So that's one factor. I don't know to what extent COVID is a factor, not so much for the unhoused, but maybe more for the fact that more businesses are closed for different periods of time, and there's less people calling in types of things. So honestly, I would just be guessing. If anyone else has a theory, I'm all ears.
Thank you.
Anyway, we will continue to monitor. I think it's helpful to know, and it's also nice to know when the numbers are down. I won't take credit when the numbers are down, because then I'd have to take credit when the numbers go back up. So you have to be careful with that one. So at any rate, it's all good news. So with that being said, survey. The mayor mentioned earlier that we had done an impromptu last-minute survey. And I will say that the survey was in part prompted by some criticism of the work that our group has done. And I won't say that it's unfair criticism, because, I think from an outsider perspective, or even those that attend, sometimes I think there is appearance that we're not doing as much as we can. I think we all realize this is an extremely difficult problem to solve, and there are no easy answers. So I really wanted to kind of find out where the group landed in terms of the value of our committee, the work that we're doing, and of course, more importantly, to do a little reset and look at and see what our priorities should be. So with the survey, let me bring that up here real quick. So the survey, just a quick survey, we had 13 of our roughly 24 members, so almost a 50% response rate, and that's actually really good considering I only put it out yesterday. So also, as the mayor mentioned, really do want all of our members to fill this out. And so I don't anticipate that we're going to make any decisions based on the data, because we don't have all the input from our members yet. But I think hopefully this will plant some seeds and whet your appetite to be thinking about what our priorities should be. You'll see as I go through this that there are some common themes, and there's some things that I think are pretty substantial tasks, but I also think there's quite a few things on there that are easy things that we can knock off too. So the mayor and I talked a little bit about it earlier, and the plan is that, again, we put this information out, try to get 100% participation on our survey, and then we'll dedicate a substantial portion of our next meeting to address these priorities. So with that being said, I'm just going to go through here, and I am going to read the results of this, because I know we have at least one person's on the phone, and for those that don't have the computer access, it's going to be hard to read this on a phone. So, so everybody can see the screen, I trust. Any head nods? Okay. All right, Teresa, I saw your thumb up, so good. So the first one is just more of a question about how long people have been involved in the committee, as most of the individuals have been with us since the inception, which is about 3.5 years ago now. Hard to believe that much time has passed. I'm not sure what I was going to do with this information. I guess it's just more out of curiosity. So to what extent the committee has provided value, and out of the 13 responses, 2 said that it's provided a great deal of value, 4 said a lot, 5 said a moderate, and 2 said a little. And overall, I would say that this obviously is a positive response. 11 people felt that at least at the bare minimum, we provide a moderate amount. So I think the individuals that said a little, this is all very fair critique of the work that we're doing. If you look at the time that we've been meeting over the last 3 years, on some level, it looks like we haven't accomplished a lot. But again, this is a difficult thing. And when we talk about relationships and working together, I think that's been huge. But anyway, so To what extent has the host committee strengthened your relationships with other partners in our effort to address the homelessness challenges? So this one, again, was pretty significant in terms of the vast majority of people felt at a bare minimum it improved their, or not, I shouldn't say improve, but increase their relationships at least a moderate amount, with 5 people saying to a great extent and 3 people saying a lot, 3 people saying a moderate amount, and 2 saying a little, and nobody said none at all. So I sound like a broken record, but to me, this is, for me personally, has been one of the biggest values of this group. The next one, does the host continue to play a useful role in helping members address the problem of homelessness? Overwhelmingly, 11 people said yes, and 1 person said no. So I think that's a pretty positive response, and at least pretty telling in terms of we need to continue our work and not abandon the work that we've been doing. So the last question, or the second to last question anyway, was, pick 3 top things that you would like to work on. So I did break these down by the 3 different priorities. There, you'll see that there are some repetition because nobody knew what everybody else was sharing. And because they're listed in priority by 1, 2, and 3, doesn't necessarily mean that they are a priority. It's just that these were the ones that the groups put as their first priority. And then the same with the slides 2 and 3, which I'll get to in just a second here. So I'll just go through these pretty quickly. Again, for those that don't have a screen, the ideas are promoting accountability, helping filling empty bellies source a building for a drop-in center, marginalized POPs. Does anybody know what that means? I don't know if that's their dad or if it's something else.
Populations, maybe?
Populations, maybe.
Okay, yeah, that could be it. Securing housing, locating shelter for those that want it, recommendations to statutory entities, zoning laws, vacation rentals, property tax, incentives to develop ADUs for property owners, engaging the unhoused with services, mental health, etc., identifying a location as a potential navigation center and who partners would drop-in center, focus on a single resource-driven tangible item to deliver, follow through with the new homeless advocates, guiding the new liaison positions. So going to the next slide. Priority 2, sourcing land for a possible tent site and look into creating low barrier housing, supportive housing for mental health, substance use, etc. Daytime drop-in and resource center, providing wraparound services, increasing the days open for warming shelters, drop-in center identifying the types of housing needed, transitional, permanent, supportive, low income, assist the various agencies, entities in this field in our area in consolidating their efforts instead of multiple ad hoc citizen groups, set guidance for new advocates, increasing local capacity by identifying funding streams and lead organizations. And then the last priority 3 is educating our community on the mental health and homelessness crisis in our county, specifically how closely they intertwine, landlord outreach, specific area for camping with oversight, shelter, identify programs to help the unhoused get into and stay connected to services, designate a single spot for congregation, assembly of homeless individuals seeking meals or other resources that is sufficiently equipped for that purpose, and identifying barriers to housing development. So I personally think some really good ideas here. Again, there is some repetition, and that's good. That means that we're all on the same page in terms of some of the ideas that we're hearing from several people. And I think that's going to help in terms of identifying the priorities of our group. The last slide was just anything else that anybody wanted to add. One of them comment was, I think our effectiveness is just ramping up, and it's important we continue to build on this momentum, whether through the committee or a similar one. I agree. The second one was, I look forward to sharing filling empty bellies uniquely on the ground, hands-on perspective with the host. And it may require a different group of folks to sit at the table, but this is clearly a lack of housing unit problem that is going to require a systemic fix. we can add 100 case managers, advocates, and it still won't lead to increased housing in absence of increased housing units. So all good points. Again, very insightful. I appreciate the input from the individual so far. And if you haven't done the survey as one of our members, please do. And I will then, once I have all the data, I will put it all together in some form and send it back out to the group so that we have a productive conversation at our next meeting. So with that, any questions on the survey, or anybody want to just jump in discussion-wise in terms of how best to identify what are going to be the group's priorities? Mayor, Arlene? Yes.
I wondered, is there still discussion of using the old library, the old police station as a drop-in center, or is that a possibility?
I hope you're referring to the jail. I mean, is that what you're referring to as close to the old police station?
Yeah, I'm sorry. Yeah,
that's all right. I didn't know I was moving.
Chief, I can speak to that if you'd like.
Okay, yeah. Monica, was that you?
Yeah, so in regards to the old jail, that is something, that regularly comes up. And one of the things that the county is planning to do in the 21-22 fiscal year is a space feasibility study. And in that work, we'll kind of be looking at, okay, what does the county see as a need for that jail? And then from there, is that be converted into a drop-in center? And Raven and I haven't had an opportunity to meet up yet because, they took the old jail up in Multnomah County and they have converted that and it's working out well. That jail was built more recently than our jail. And so that's one of the factors that we'll have to work through because our existing jail is not a very humane or happy environment. There is not very much natural lighting at all. And so just trying to figure out if it was to be converted to a drop-in center, how is it going to best be used so that it's not creating an environment that causes people to have anxiety or feel upset because of previously perhaps having been incarcerated in there or something to that effect. So that is something that we're looking at and going to be evaluating through this whole process.
Thank you.
Thank you, Monica. Any other thoughts on the survey? Any surprises? Okay.
Well, I'll just make the note that, I'm very glad to see that the majority of people find the group useful. The purpose of this group is to be useful for its members. And as long as it continues to be useful for the members, which I think it will be as long as the members have input to the agenda and to the topics, we're really happy to continue the group moving forward. And if the majority of the group felt it wasn't useful anymore, then, well, first of all, you probably wouldn't be on the call because you all have better things and other things to do, but then we would disband. So as long as, the group continues to find it useful and your input to the process, your input to the agenda is what's going to make it useful.
Steve Spalding, I had
Hi, Teresa.
Mayor, sorry, it's Monica again. I just would like to also add that, I think that it's great that you all have established this group. And I think it has set an example because I know that the city of Seaside is trying to do something similar. And so I think that it'll be a good opportunity if they do get something set up where the two groups can kind of learn from one another and what is working and what isn't working in each of their own areas.
Right. That's a good point, Monica. And I will share with that Chief Ham is also on the call. I'm not going to put him on the spot, but he and I have had a lot of conversations, sharing some of our challenges, but also sharing some of the work we've done and sharing some of the work they've done. So always good to, keep communication with our South County partners. So it's good stuff. Let's see. Teresa, did you have a question, a comment?
Yeah, I guess a question and maybe a comment. I didn't fill out the survey because I'm so new to the group. I didn't know that I could speak to all of those things, but I definitely, I know that it keeps coming up that Monica's been talking about the, the resource or navigation or drop-in center that's going on, and that Oz is talking about that. And I've definitely, reached out to various people about that. So I'm kind of wondering how that can work, if that's like maybe a subcommittee of different organizations that can, work with the county, or how everybody that wants to see that happen can be working together most effectively.
Yeah, well, I think part of the answer to that question is, as somebody mentioned in one of the comments, is that there's a lot of different entities working on different things. So, I think it's helpful to have a coordinated approach, because clearly, we don't want to reinvent the wheel, and, we want everybody trying to work together on some of these things. For me, as far as at least putting my host hat on, I think we need to identify what we as a group feel are the priorities. And then I think we decide how we move forward. And that could be setting up additional subcommittees or whatever. Of course, I would defer to the mayor and his thoughts on how he'd want to move on. And hopefully that we're going to be in alignment with the council goals as well, in order to get support. But because this is, even though this started as somewhat of an Astoria-centric committee, it really has expanded, and we're very much working very closely with our county partners and all of our partners. So this group really has become a much bigger in terms of reach than just the city of Astoria.
Yeah, so the county, in their strategic plan, they added that as a specific item. And Monica, I don't want to speak for Monica, she can jump in, but they added that on as a specific item in their strategic plan, that they want to accomplish a navigation center, drop-in center. And the city looked at that, and we added that as one of our council goals. And we're looking at it as we are supporting the county's work, whether that's as part of a work group, certainly resources. By putting it as one of our goals, we're committing that, when the county comes up with a plan for a drop-in center, we figure out what the resource requirements are, the city will contribute our fair share of that. So I don't really see setting up another committee. I would just really kind of defer to the county via Monica as far as what they need and what progress they're making, and at what point do they need input from this group or resources from this group.
Thanks, Mayor. And I'll just say that as the county is going through this process, what we are doing is we are identifying who those community partners are. So, for example, the Warming Shelter, Clatsop Community Action, the Beacon House, the Harbor, CBH. So a lot of those entities that we already work with, and trying to figure out what some of the barriers for their clients are. If you're trying to get somebody set up for a mental health appointment, and they also need to address some other health issues, oftentimes they lose sight when they're going from one location to the next location. And so trying to figure out what are all those resources that are needing to be in a single location to best get this person connected and stayed connected in services. And so we're working on identifying who those community partners are, as well as other local government jurisdictions, because they're having to deal with some of these populations through those law enforcement calls and such. And so we will identify those immediate groups that we know of, and then once we start having those committee meetings, identifying, okay, well, who's handling this, and if that person isn't currently part of a committee, or that group isn't currently part of a committee, then saying, okay, well, who do we need to get connected to bring them in? So I see this as an evolving process, because obviously at the first meeting we're not going to have everybody that should be involved. And then to the mayor's point, there are going to be resources that are necessary to help this. And so in some instances, it might be involving private organizations. It might be involving faith communities. And so just trying to figure out what is it that we need, where are we going to put it, and how is it going to get paid for and sustained for a long period of time.
Thank you, Monica. Any other thoughts? Okay, looks like we're already at roundtable. So the meeting is moving forward a little quicker than I thought, but that's okay. I know you all have a lot of things to do, so I'm going to go through my roster. Mayor, I will save any final comments for you towards the end, if that's okay with you. And so I'll just start off with Councillor Herman. Do you have anything for the group?
I do not, Chief, but thank you.
Thank you. Councillor Rocca?
No, I guess I've been pondering what has recently been said, and focus is important on things, and I guess I am wondering whether at some point, once the host group's priorities are decided, whether there may be times when there is application for a subcommittee to bring focus to a particular issue and work on it between meetings, and then come back to the host group with the progress. And I think what the advantage of that would be that the participating agencies would have a chance to get together in between and work together. So I'm not sure that idea doesn't have application as we go forward.
Thank you, Councillor. And I will say that, over the past several years, we've actually had several subcommittees, and I do think that where a lot of good work has been done in the committee, we had, the employment subcommittee, the clean slate program, the county-wide liaison program, was a subcommittee. So there's been 4 or 5 of those that have all done a lot of good work. So yeah, definitely an option. All righty, so going down the roster, Teresa, anything else for the good of the order?
Oh yeah, I just had a comment about the health and wellness event that CCA put on. I was talking to Viviana and Susan about that kind of early on, and they had suggested the warming center being open that night for people getting the vaccine. And yeah, so we only had a few guests come in, but I thought it was a really beautiful example of all these organizations working together. I had a staff member giving haircuts at CCA that they had spoken with her about. We had, I was able to make connections with a lot of different organizations there. One of the guests that stayed at the warming center that night was able to call CBH. I got a Recovery Allies card and then get into a program at Helping Hands. So yeah, it ended up really beautiful. We had a little tiny pizza party. So thanks so much to them for putting that on. And yeah, hopefully I'm going to be working with public health about doing a little vaccine clinic here in the future. Yeah, I love that I didn't fill out the survey, but that someone had put on having the warming center be open more often. So that's something that I've have been working with the city on about, trying to get our conditional use permit extended and just trying to meet that need for resources until there is a navigation and drop-in center. And so, yeah, I look forward to working with anybody who's interested in helping me with that. Oh, and also happy to join the group. Thanks, guys.
Thanks, Teresa. And do feel free to fill out the survey regardless of your limited tenure. So it's all good. Let's see, Jonah. You're good?
I'm good, thank you.
Okay, thank you. Mike Davis?
I'm good, thank you.
Officer Hanson?
I'm good, thank you.
All right. Jared? Jared, are you still with us? You might have had to sign off. Okay. Arlene?
I'm just curious if there has been an increase in the homeless population going back up into the woods again.
Well, if there are, I honestly can say that I'm not aware of it. We haven't had substantial amount of calls. And I will say that part of it, I think, is because of the weather. And we are not proactively going out and seeking the camps. But we do get calls every once in a while, and especially the ones that are very close to people's neighborhoods when they see people coming and going, and we get those kind of calls. But I don't think it seems to be any worse than in the past. But I honestly don't have a good handle on that either.
Thank you.
Sure. Viviana?
No, other than today's our first day for our summer mobile produce pantry. So that is something that we do once a week in Astoria, Warrington, and Seaside. So the first day. Okay. And we see roughly about 250 families per city. So thank you.
Great. Thank you, Viviana. And Julia, on behalf of Public Health, are you still online? Okay, Oz?
No, I'm good. Thank you.
Okay. Cindy?
Thank you, Chief. As I've just written previously, the Chief and the Mayor, between traveling and family deaths and COVID, I am so far out of the loop now of all the good work that you guys are continuing to do that I think it would be best at this point if I stepped off as a member, because now you even have a new secretary. But I am still very interested in the challenges that we face as a community and as service providers. So I would like to continue attending the meetings as a guest. And I just thank you all for continuing the great work that you do.
Thank you. Well, I appreciate your service to the group and your contribution, and sorry to see you go, but happy that you're willing to stay on as a guest.
I'll be around, and if I can be of help, I please do let me know.
Okay, will do. Thank you. David.
Thank you. Turn my camera on here. Sorry, I didn't realize I was off. I will say it's intersectional to what we're talking about. It's not a direct correlation, but the pain point for businesses right now, small businesses in particular, is employees. And so two things are going to happen. One, we got this moratorium on evictions that are going to come to a head. Looks like maybe June 30th. Is that right? But we also have the extended unemployment benefits that are going to come to an end at the end of August. So there's a lot of frustration for the employers that they just can't meet demand because they can't get people to come to work. But there's also a lot of now demand for people to be able to pay their rent. So somewhere in there, we've got to do something with folks that are able to work and that are willing to work to get them connected back with those jobs. Because really, that's going to be a problem for our businesses. We're going to have some of them shutting down simply because they can't. They can no longer go 6 and 7 days a week with just the employer or just the owner doing it. So again, intersectional, not directly related to the issue we're talking about here, but part of the puzzle. And if there's anybody has any brilliant ideas there to connect people who want jobs and who need money with the jobs that are available, this is the time to do it.
Great, thank you, David. Brooke.
Thank you. I just want to say the CCO is very interested in the Navigation and Drop-In Center, and I'm excited about all the work that's moving forward, and just be sure to loop us in as you're having those discussions. And then also a reminder that we do have our Regional Housing Impact Fund to help with a grant that people can apply to or organizations can apply to help fund housing projects. And that's all I have. Thank you.
Great. Thank you, Brooke. Terry.
Hi. I think I said this last time, but I just wanted to reiterate that, I mean, we're seeing an increased need in people wanting to get out of some of their housing situations and unfortunately have to choose to stay in some of these abusive situations so they don't actually end up being houseless. And so we're just doing a lot more safety planning on how folks can actually live safely with their abusers. So, not necessarily houselessness, but could contribute to the problem. And we know statistically that many women who are living on the streets actually did experience domestic violence at some point in their lives. So just to let you know that that's happening. And then we also find that it's just really hard to get people housed or even into hotels sometimes, especially if landlords and hotel owners know that folks are living in domestic violence situations because that seems scary to them. So some sort of community outreach around that would be helpful.
Thank you, Terry.
Okay, thanks.
Mayor, for you for closing comments, and I will come back to any guests that would like to add anything.
Thanks, Chief. Thanks, everyone, for your input today. And I guess two things. The first, I noticed one of the survey comments was from Filling Empty Bellies, looking forward to making a presentation. So there's one agenda item for the next meeting, Chief. We can take Filling Empty Bellies up on their offer to do a presentation on what they're seeing on the ground. And the next topic I brought up at the last meeting, that we are looking to transition Chief Spalding out of the leadership of this group sometime this year. He's been doing it for over 3 years. It's been a huge contribution that he's made, and I want to give him the opportunity to be able to step down and pass that role on to someone else. So if you can be thinking about who you think might be a good leader of the group, or if you're interested in being it at some point, next meeting or the meeting after that, we'll be looking more closely at identifying a new leader to take Chief Spalding's place sometime this year.
Thank you, Mayor, and likewise, I look forward to the opportunity to give somebody else an opportunity to come up with some fresh ideas and help move the committee to the next level. I've enjoyed doing it, and I sure hope to remain very much involved in it. But it is one more commitment on top of my extremely busy schedule. So I want to make sure that that whoever takes it over has the time to give it the appropriate amount of time that it deserves. So thank you for that. Yes, anybody, I would say do a hand raise or just a shout out, I think would be sufficient. Ron?
Yeah, I would like to mention, has Teresa Barnes been officially, has she given her, she's our executive director at the Warming Center, and has she been introduced as the executive director, which is a big step for the Warming Center, which we now have an executive director. So
yeah, we did introduce her as the newest member of our group, but I don't know that we formally recognized her in that new role. And I think I thought it was common knowledge, at least to me anyway. So Teresa and I have already had a couple good conversations. So Teresa, anything else you want to add to that?
No, thanks, Ron. Yeah, no, just I'm happy to be a member. Thanks, everybody.
Thank you. Thank you, Ron. Chief Ham, how you doing?
I'm doing well. Thanks. Hi, everybody. I just want to make a couple of comments. One, in regards to Cheryl coming out and working on the Canicum and 12 with that RV last week. I actually happened to make a contact with the one who's been there for pretty much a year, who's still there. But last council meeting, end of April, there was quite a few community members who had come and raised concerns, comments, and with the city council about that area. And so it was great timing that she had come over that day. I had actually made contact with somebody there, unrelated, and they had mentioned that they had been in contact with her. And so it was neat to see that liaison and community person was out there working that. So thanks to Cheryl for making that contact and getting that other RV out of there, it sounds like. So there's just the one there right now. We've been up to 3 or 4 in that area at any one time, hoping that it's going to get the other one out of there at some point in the near future and clear that area up. The other thing I wanted to kind of comment about is that tonight the Seaside City Council is meeting, having a workshop at 6 p.m. at the Convention Center. They've obviously, if you haven't paid any attention to it, has made homelessness a part of their strategic plan and goal setting session. Tonight's topic on homelessness, I think, is specifically asking for community faith-based organizations to be there. So anyway, it's tonight, 6 o'clock, Convention Center. It's open to the public. It's also live streamed on the City of Seaside YouTube page. So if you're interested in sitting in and watching from home or anything and just see what Seaside's doing tonight, you can find the city website link there and click on it and watch. Otherwise, it'll be on the internet forever after this anyway. You can watch it tomorrow or whenever. So anyway, those are only two things I had to bring up. Thanks for having me.
Thanks, Chief. Appreciate you being here, and I'm glad you're using all my good ideas over there. So, all righty. Let's see. Any other guests? Okay, seeing none, I tentatively set the next meeting for July 8th at 10 o'clock. I have not confirmed that with the mayor yet, so that is subject to change. But I just want to have a placeholder meeting and then be thinking about the survey results and what the priority should be. And please fill out the survey for our members. And lastly, I want to say that in the meeting itself, there's a lot of good comments. If you guys haven't opened your chat window, there's some good discussion going back and forth, as the meeting's in progress. So some good information in there. And I encourage you guys to check that out. And with that being said, if there's no other final closing comments from anybody, I will move to adjourn.
Second.
Okay. All in favor?
Aye.
All right. Thank you, everybody, and have a great day and stay healthy.
Thank you.
Thanks, Chief.
Bye-bye.